The automatic doors of St. Mary's Hospital emergency room slid open for the 100th time that day. It was a Tuesday afternoon and the ER was packed with people. Some sat in the waiting area holding ice packs to their heads. Others coughed into tissues. A child cried in his mother's arms. The fluorescent lights buzzed overhead, mixing with the constant beeping of machines and the shuffle of feet on the clean white floors. Patricia Chen stood at the nurse's station, her eyes scanning the computer screen in front of her. She had been the head nurse in this ER for 12 years. She had seen everything from minor cuts to major car accidents. Today felt like any other busy day. 3 nurses worked beside her, checking charts and preparing medication. The phone rang constantly. Somewhere down the hall, a doctor called out orders. The radio on Patricia's belt crackled to life. An ambulance was 2 minutes away. A patient with chest pain and trouble breathing. Patricia felt her body shift into professional mode. Chest pain was serious. It could be nothing or it could be a heart attack. They needed to be ready. She called out to Jamie Rodriguez, one of the younger nurses. Jamie had only been working at the hospital for 8 months, but she was quick and caring. "Jamie, we have an incoming chest pain." "Bay 7. Get it ready?" Jamie nodded and rushed off. She grabbed a blood pressure cuff, arranged the monitors, and made sure oxygen was available. Another nurse, Michael, joined her. He was older, with gray hair at his temples and steady hands. He had worked in emergency rooms for 20 years. Together, they prepared the space. The ambulance arrived with its lights flashing. The paramedics pushed through the doors with a stretcher. On it lay an elderly woman. Her skin was dark and covered with a thin layer of sweat. Her face showed pain, but she kept her lips pressed together, trying to stay strong. She wore a simple blue dress and comfortable shoes. A brown purse sat on her lap, which she held tightly with both hands. "This is Mrs. Eleanor Williams," one of the paramedics said as they wheeled her in. 68 years old. Called 911 for severe chest pain and shortness of breath. Started about an hour ago. Pain is in the center of her chest, radiating to her left arm. Blood pressure is elevated at 160/95. Heart rate is 110. Patricia walked alongside the stretcher, listening carefully. These were classic signs of a heart problem. They needed to move fast. "Take her to Bay 7, she directed. The team moved Mrs. Williams onto the hospital bed. Jamie immediately began attaching monitor leads to her chest. The machine beeped to life, showing her heart rhythm. Michael wrapped the blood pressure cuff around her arm. Another nurse started an IV line in case they needed to give medication quickly. Mrs. Williams breathed in short, shallow breaths. Her eyes moved around the room, taking everything in. Despite her pain, she maintained a certain dignity. When Patricia leaned over to ask her questions, the elderly woman tried to sit up straighter. "Mrs. Williams, I'm Patricia, the head nurse. Can you tell me about your pain? How bad is it on a scale of 1 to 10? "About an 8, Mrs. Williams said quietly. Her voice was cultured and calm despite the circumstances. "It feels like pressure, like something heavy sitting on my chest. And my arm tingles. Do you have any history of heart problems?" "High blood pressure. I take medication for it. Any allergies to medications?" "No," Patricia made notes on the chart. Everything Mrs. Williams described pointed to a cardiac event. They needed a doctor to see her immediately. Patricia looked around the ER. It was chaos. Dr. Sarah Martinez, the ER director, was in surgery. Dr. Patel was handling a car accident victim. That left Dr. Richard Thornton. Patricia felt a slight sinking in her stomach. Dr. Thornton was skilled, there was no question about that. He had been working as a doctor for over 20 years. He knew medicine. But his bedside manner left much to be desired. He was impatient with patients. He sometimes made snap judgments, and Patricia had noticed over the years that he seemed especially dismissive with certain patients, but there was no choice. Mrs. Williams needed a doctor now. Patricia walked to the other side of the ER where Dr. Thornton was finishing up with another patient. He was a tall man in his early 50s with gray hair combed back from his forehead. He wore the standard white coat over blue scrubs. His face showed tiredness and irritation. "Dr. Thornton, we have a 68-year-old female with chest pain in Bay 7, classic cardiac symptoms. She needs to be seen right away." He glanced up from his chart. "Fine. I'll be there in a minute." Patricia returned to Mrs. Williams. The elderly woman's breathing seemed more labored now. Her lips had a slightly blue tint. This was not good. Jamie noticed it too and increased the oxygen flow. "You're going to be okay," Jamie said softly, patting Mrs. Williams's hand. "The doctor will be here soon." Mrs. Williams nodded but didn't speak. She closed her eyes and focused on breathing. Her fingers still gripped her purse. Inside the ER, the noise continued. Phones rang. People talked. Machines beeped. Life went on at its frantic pace. Michael checked the monitor again. "Patricia, her heart rate is climbing." Now at 120. Patricia felt the urgency increase. Where was Dr. Thornton? She looked toward the nurse's station and saw him there talking on the phone. He didn't seem to be in any hurry. She wanted to go pull him away from the call, but hospital hierarchy made that complicated. Nurses couldn't order doctors around. Finally, after what felt like forever but was really only 5 minutes, Dr. Thornton walked toward Bay 7. He carried a tablet computer and had a stethoscope around his neck. His face showed no particular concern. To him, this was just another patient in a long line of patients on a busy day. Patricia stood back to give him room. Jamie and Michael moved aside but stayed close, ready to help. A medical student who had been shadowing Dr. Thornton that day stood in the corner, watching and learning. Dr. Thornton glanced at the monitors, then at Mrs. Williams. He didn't smile or introduce himself. "So chest pain?" he said, his tone flat. Mrs. Williams opened her eyes. "Yes, doctor. It started about an hour ago. It's very painful and—" "Are you taking your medications?" he interrupted. "Yes, every day. I take my blood pressure medicine and—" "Do you smoke?" "No, I quit 30 years ago. Do you drink alcohol?" "Occasionally, maybe a glass of wine with dinner." Dr. Thornton typed something on his tablet. He seemed to be going through a checklist rather than really listening to her. Patricia watched, feeling increasingly uncomfortable. This wasn't how you treated someone with potential cardiac emergency. You needed to listen. You needed to show care. "Any recent stress?" Dr. Thornton asked. "Well, yes," Mrs. Williams said. "I've been traveling and my daughter just had some health issues, so I've been worried." "Stress," Dr. Thornton said, as if that explained everything. He didn't ask any follow-up questions about her daughter or her travels. He put his stethoscope in his ears and listened to her heart, but only for a few seconds. Then he listened to her lungs. Patricia exchanged a glance with Jamie. The young nurse's face showed confusion. This examination was too quick, too superficial. Mrs. Williams was showing clear signs of cardiac distress, but Dr. Thornton didn't seem particularly concerned. The elderly woman tried again to explain her symptoms. "Doctor, the pain is really severe. It feels different from anything I've experienced before. And my arm—" "Mrs. Williams," Dr. Thornton said, cutting her off again. "A lot of people come into this ER thinking they're having heart attacks. Most of the time it's anxiety or heartburn or muscle pain." Mrs. Williams' face showed surprise and hurt. "But doctor, I know my body and this feels serious." Dr. Thornton stepped back from the bed. He crossed his arms. The medical student in the corner shifted uncomfortably. Something in the room felt wrong. The air seemed heavy. "We'll run some basic tests," Dr. Thornton said, "but I've seen this many times. You're probably fine." His tone suggested he thought she was wasting his time. Patricia felt anger rise in her chest, but she swallowed it down. She was a nurse. He was a doctor. That was how the hospital worked. But every instinct she had told her this was wrong. Dr. Thornton stood by Mrs. Williams' bedside with his arms crossed. His body language showed he had already made up his mind. Patricia watched from a few feet away, her clipboard pressed against her chest. Something felt very wrong about this situation, but she didn't know how to stop it. Mrs. Williams tried once more to explain what she was feeling. "Doctor, please listen. The pain is not going away. It's getting worse. I feel like there's an elephant sitting on my chest. My left arm is numb and I feel dizzy." "Everyone feels dizzy when they're anxious," Dr. Thornton said. He didn't look at her face when he spoke. Instead, he scrolled through something on his tablet. "Your vital signs are elevated, but that's consistent with anxiety." "I'm not anxious," Mrs. Williams said firmly. "I'm in pain." Dr. Thornton let out a small sigh, the kind that said he was losing patience. "Mrs. Williams, I've been a doctor for over 20 years. I know the difference between a real emergency and someone who's overreacting." The word overreacting hung in the air like poison. Jamie, the young nurse, felt her mouth fall open slightly. Michael, the experienced nurse, froze in place. Even the medical student in the corner looked shocked. Did Dr. Thornton really just say that to a patient with clear cardiac symptoms? Patricia felt her heart beat faster. She had seen Dr. Thornton be dismissive before, but this was different. This was dangerous. Mrs. Williams could be having a heart attack right now, and he was treating her like she was making it up. "Doctor," Patricia said, trying to keep her voice steady and professional. "Her symptoms are consistent with acute coronary syndrome. Shouldn't we at least run a full cardiac panel and get an EKG?" Dr. Thornton finally looked up from his tablet. His eyes were cold when they met Patricia's. "Nurse Chen, I'm quite capable of determining what tests are necessary. We'll do a basic EKG and some blood work, but I'm confident this is not a cardiac event." "But doctor?" "That's my decision." Patricia felt her words die in her throat. In the hospital hierarchy, doctors had the final say. Nurses could suggest and advocate, but they couldn't force a doctor to order certain tests. She felt helpless and angry at the same time. Mrs. Williams's hand trembled as she adjusted the oxygen tube in her nose. Her breathing was becoming more rapid and shallow. Sweat continued to bead on her forehead. Every sign pointed to a serious problem, yet Dr. Thornton seemed determined to dismiss it. "Are you currently employed?" Dr. Thornton asked suddenly. Mrs. Williams looked confused by the question. "I'm retired. And what do you do with your time?" I travel sometimes. I spend time with my family." "Why does this matter?" Dr. Thornton made a note on his tablet. "Just gathering information." "What kind of insurance do you have?" Patricia felt a cold sensation wash over her. Why was he asking about insurance? What did that have to do with treating chest pain? Jamie looked equally confused. Michael's jaw tightened. "I have Medicare," Mrs. Williams answered. Her voice was weaker now. The pain was clearly worsening. Dr. Thornton said, as if this confirmed something for him. "Look, Mrs. Williams, I'm going to be straight with you. A lot of people come into this ER looking for attention or trying to get admitted for a free place to stay. We have limited resources here. We need to save them for people who are really sick." The words landed like a slap across the face. Mrs. Williams's eyes went wide. Her mouth opened, but no sound came out. She looked like she couldn't believe what she was hearing. "I am really sick," she finally managed to say. Her voice cracked. "I would not call an ambulance and come to the hospital if I wasn't in serious pain. I don't want to be here. I need to be here." "That's what everyone says," Dr. Thornton replied. His tone was casual, almost bored. "But the reality is most chest pain is not a heart attack. You're probably experiencing indigestion or a panic attack. Both are unpleasant but not life-threatening. The stress you mentioned is likely the real culprit here." He moved closer to the bed and lowered his voice, but everyone in the bay could still hear him. "Let me give you some advice. Instead of running to the ER every time you feel stress, maybe try dealing with your problems in a more constructive way. There are community health centers and social services that can help people in your situation. The emergency room is for emergencies." Patricia felt like she had been punched in the stomach. People in her situation? What did that mean? The implication was clear, and it was ugly. She looked at Mrs. Williams and saw tears forming in the elderly woman's eyes. But Mrs. Williams didn't cry. She pressed her lips together and breathed through her nose, maintaining her dignity, even as this doctor humiliated her. Jamie couldn't stay quiet anymore. "Dr. Thornton, with all due respect, her symptoms are serious. Shouldn't we—" "Nurse Rodriguez," Dr. Thornton said sharply, cutting her off. "You've been qualified for what, 6 months? 8 months? I don't need medical advice from you. Do your job and let me do mine." Jamie's face turned red. She looked down at the floor. Patricia wanted to defend her, wanted to defend Mrs. Williams, wanted to do something, but the words wouldn't come. She had a mortgage to pay. She had worked hard to become head nurse. Speaking up against a senior doctor could have serious consequences for her career. Dr. Thornton had friends in the hospital administration. He had been there longer than she had. But was her career worth more than this woman's life? Michael stepped forward. He was older and had more experience than Jamie. Maybe Dr. Thornton would listen to him. "Doctor, I've been a nurse for 20 years. I've seen a lot of cardiac patients. This woman is showing classic signs of—" "Enough," Dr. Thornton snapped. "I don't need input from the nursing staff. I went to medical school. I did my residency. I'm the doctor here. You're the nurses. Know your place." The words were harsh and demeaning. Michael stepped back, his face showing a mix of anger and frustration. He looked at Patricia, silently asking what they should do. Patricia didn't have an answer. Dr. Thornton turned back to Mrs. Williams. "Here's what we're going to do. We'll run a basic EKG and check your cardiac enzymes. If those come back normal, which I expect they will, you'll be discharged. You can follow up with your primary care doctor if you're still concerned. But I'm not admitting you. We have people with real emergencies who need these beds. He spoke to her like she was a child, or worse, like she was stupid. Mrs. Williams closed her eyes. A single tear rolled down her cheek, but she wiped it away quickly. She pulled her purse closer to her chest, holding it like a shield. Do you understand? Dr. Thornton asked. I understand, Mrs. Williams said quietly, but her voice carried something else now, not just pain, but disappointment. Disappointment in the system. Disappointment in this doctor. Maybe disappointment in humanity itself. Dr. Thornton typed final notes into his tablet. Nurse Chen, order a basic EKG and cardiac enzyme panel. Nothing extensive. If she's still symptomatic in a few hours and the tests are normal, give her some antacids and discharge her with instructions to follow up with her regular doctor. Yes, doctor, Patricia heard herself say, though the words tasted like ash in her mouth. Dr. Thornton walked away without another word. He didn't say goodbye to Mrs. Williams. He didn't tell her he hoped she felt better. He just left, already thinking about his next patient or maybe about lunch. The medical student who had been observing followed him, looking back once at Mrs. Williams with an expression of confusion and concern. The bay fell silent except for the beeping of the monitors. Patricia, Jamie, and Michael stood frozen. They had just witnessed something terrible, but none of them had stopped it. They had all found reasons not to speak up louder, not to push harder, not to go over Dr. Thornton's head. Patricia finally moved. She came to Mrs. Williams' bedside and touched her hand gently. I'm so sorry, she whispered. Mrs. Williams opened her eyes. They were red, but no more tears fell. It's not your fault, she said. But they both knew that wasn't entirely true. Sometimes doing nothing was its own kind of fault. We're going to take good care of you, Jamie said, her voice thick with emotion. I promise, Mrs. Williams nodded but didn't respond. She closed her eyes again and focused on breathing. In and out. In and out. Each breath seemed to take more effort than the last. Michael prepared the EKG machine. His movements were angry and sharp. He was furious, Patricia could tell. They all were. But fury didn't help Mrs. Williams. Action helped, and they had failed to take the right action. The minutes after Dr. Thornton left felt heavy and thick. Patricia stood at the nurse's station, staring at the computer screen without really seeing it. She was supposed to be entering orders for Mrs. Williams's tests, but her hands wouldn't move. All she could think about was the look on that elderly woman's face when the doctor had dismissed her pain and dignity in one cruel conversation. Jamie walked up beside her. The young nurse's hands were shaking slightly. Patricia, she said quietly, that wasn't right. What just happened wasn't right. Patricia glanced around to make sure no one else was listening. The ER was still busy with its usual chaos, but their corner felt like a separate world. I know, she said softly, so what do we do? Jamie's voice carried hope, like she expected Patricia to have a solution. Like Patricia would know how to fix this. But Patricia didn't have answers. She had questions, doubts, fears. I don't know, she admitted. It's complicated. How is it complicated? Jamie asked, her voice rising slightly with frustration. A patient is in pain. A doctor dismissed her without proper examination. We all saw it. We should report him, Patricia sighed. She remembered being young like Jamie once. She remembered believing that doing the right thing was simple. You saw something wrong, you fixed it. But years of working in hospitals had taught her that nothing was ever that simple. Jamie, you've been here 8 months. You don't understand how things work yet. Then explain it to me, Jamie challenged. Because right now all I understand is that we're letting a woman suffer because we're afraid of a doctor. The words stung because they were true. Patricia looked at Jamie's face and saw the disappointment there. She was disappointing this young nurse who still believed in justice and doing the right thing. She was disappointing herself. Michael joined them at the nurse's station. His face was tired and sad. I ordered the EKG, he said. I'll run it myself to make sure it's done properly. Thank you, Patricia said. Michael leaned against the counter. This isn't the first time, you know. Dr. Thornton has done this before. Jamie's eyes widened. What, he's treated other patients like this? Michael nodded slowly. Not always this bad, but yes. I've seen him be dismissive with certain patients. Especially patients of color. Especially women. especially people who seem poor or don't speak perfect English. Then why is he still working here? Jamie demanded. Why hasn't anyone reported him? People have, Michael said quietly. At least I think they have. But he's been here a long time. He has friends in administration. He's on some important committees, and honestly, his behavior is usually subtle enough that he can deny it or explain it away. Today was bad, but usually he's more careful. Patricia felt sick to her stomach. She had known deep down that Michael was right. She had seen Dr. Thornton treat patients differently, based on how they looked or talked. She had seen him spend more time with wealthy-looking patients and rush through examinations of others. But she had convinced herself it wasn't her problem. Doctors were in charge of medical decisions. Nurses just followed orders, except that wasn't true, was it? Nurses were patient advocates. They were supposed to protect patients. That was part of the job, part of the oath, part of the reason she became a nurse in the first place. I should go over his head, Patricia said, thinking out loud. I should call Dr. Martinez. She's the ER director. She would listen, would she? Michael asked gently. Dr. Martinez is in surgery right now. By the time she's out, Mrs. Williams will probably have her test results. If they're normal, Dr. Thornton will send her home and it'll be over. And if we complain after the fact, he'll just say we're being overly sensitive or that we misunderstood his tone. Jamie shook her head. I can't believe this. I can't believe we're just going to let this happen. We're not letting it happen, Patricia said, though the words felt hollow. We're taking care of her. We're running the tests. We're monitoring her. But we're not fighting for her, Jamie said. We're not demanding better treatment for her. We're following orders from a doctor who clearly doesn't care about her. Patricia had no answer for that, because Jamie was right. Across the ER near Bay 7, the medical student who had been with Dr. Thornton stood alone. His name was David, and he was in his 3rd year of medical school. He looked pale and disturbed. Patricia watched him pull out his phone, type something, then put it away. He looked toward Mrs. Williams's bay, then away, then back again. He was wrestling with something. Patricia walked over to him. Are you okay? David looked startled. No. I don't know. He ran a hand through his hair. Is Dr. Thornton always like that? Like what? David struggled to find words. So dismissive, so rude. That patient had clear symptoms of cardiac distress, but he barely examined her. And the things he said to her were... He trailed off. Inappropriate, Patricia supplied. That's putting it mildly, David said. I wanted to say something, but he's the attending physician. I'm just a student. If I speak up against him, he could fail me or give me a bad evaluation. That would impact my ability to get into a good residency program. There it was again, fear. Fear of consequences. Fear of rocking the boat. Fear of standing up to power. Patricia saw it in David's eyes, and she knew he saw it in hers too. What are you going to do? David asked her. I don't know, Patricia admitted. David nodded slowly. I think I might need to talk to someone about this. My ethics professor, maybe. Or the medical school dean. This just feels wrong. It is wrong, Patricia said. But be careful. Reporting an attending physician can have consequences. More consequences than staying silent while patients are mistreated? David asked. Patricia had no answer for that either. She returned to Bay 7 where Mrs. Williams lay with her eyes closed. The elderly woman's breathing was still labored. Her face showed pain with every breath. Michael was setting up the EKG machine. Mrs. Williams, Patricia said gently, we're going to do your EKG now. The elderly woman opened her eyes. Thank you, she said quietly. Even now, even after being treated so poorly, she was polite. She was gracious. It made Patricia feel even worse. Michael attached the electrode stickers to Mrs. Williams' chest, arms, and legs. The machine hummed to life. Patricia watched the paper slowly print out the reading of her heart's electrical activity. She wasn't a doctor, but she had seen enough EKGs to recognize certain patterns. Her heart sank. The EKG showed changes. ST elevation in certain leads. This was not normal. This was not anxiety or heartburn. This was a heart attack. Michael saw it too. His eyes met Patricia's and she saw fear there. Mrs. Williams was having a real cardiac event and Dr. Thornton had dismissed it as nothing. If they didn't act fast, this woman could die. I need to show this to a doctor immediately, Patricia said. Show it to Dr. Patel, Michael suggested. She's more reasonable than Thornton. Patricia nodded and grabbed the EKG printout. But as she turned to leave the bay, she heard Dr. Thornton's voice from across the ER. He was talking to another nurse, complaining about difficult patients and people who waste hospital resources. Her anger flared. She should show this EKG to Dr. Thornton first. It was his patient. He needed to see that he was wrong. But would he even care? Would he take responsibility, or would he find some way to explain away the findings? Jamie came running up. Patricia, her oxygen saturation is dropping. It's down to 88%. This was becoming an emergency. Mrs. Williams was deteriorating right in front of them. They didn't have time for politics or hierarchy or worry about consequences. Increase her oxygen, Patricia ordered. And get me whoever can see this EKG fastest. As Jamie rushed back to adjust the oxygen, Patricia looked down at the printout in her hands. This piece of paper was proof. Proof that Dr. Thornton had been wrong. Proof that Mrs. Williams was really sick. Proof that they all should have fought harder for her from the beginning. Mrs. Williams's eyes opened slightly. Am I going to be okay? She asked in a weak voice. Patricia wanted to say yes. She wanted to reassure her. But she had already failed this woman once by staying silent. She wouldn't fail her again by lying. We're going to do everything we can, Patricia said. I promise you that, Mrs. Williams nodded. Her hand reached out and Patricia took it. The elderly woman's grip was weak but determined. Thank you for caring, she whispered. Even if you couldn't speak up before, thank you for caring now. Those words broke something in Patricia. This woman, in pain and scared, was thanking her for the bare minimum of human decency. That was how low the bar had fallen. Patricia squeezed her hand back. I'm going to fight for you now. I should have done it from the start, but I'm going to fight for you now. She turned and walked toward Dr. Patel, the EKG clutched in her hand like a weapon. Patricia walked quickly across the ER floor, the EKG printout held tightly in her hand. Her heart pounded in her chest. She needed to find Dr. Patel and show her these results. Mrs. Williams was getting worse and they were running out of time. But as she passed Bay 7, something made her stop. Some instinct or feeling pulled her back. She turned and looked through the curtain at Mrs. Williams. The elderly woman's breathing was even more labored now, despite the increased oxygen. Her skin had a grayish tone. Sweat covered her face and neck. Patricia stepped back into the bay. Jamie was checking the monitors again. Her blood pressure is rising, Jamie said with worry in her voice. 170 over 100 now, and her heart rate is up to 130. This was bad. Very bad. Patricia moved to the bedside. Mrs. Williams, can you hear me? The elderly woman's eyes fluttered open. Yes, she whispered. The pain. It's worse. Much worse. Patricia's mind raced. She needed to do something right now, not in 5 minutes when she found another doctor. This woman was in active cardiac crisis. But she also needed to examine her properly. Make sure nothing else was wrong. Make sure they had all the information they needed. I need to check you over one more time, Patricia said gently. Is that okay? Mrs. Williams nodded weakly. Patricia began a thorough assessment, something Dr. Thornton should have done from the start. She listened to Mrs. Williams's heart and lungs. She checked her pulses. She looked at her color and her breathing pattern. As she worked, she tried to make conversation to keep Mrs. Williams calm and alert. You said you've been traveling? Patricia asked. Where were you coming from? Boston, Mrs. Williams said between breaths. I was there for a medical conference. Are you a nurse? A doctor? I was a doctor. I'm retired now. Patricia felt a small surprise. This elegant, suffering woman was a retired doctor. That explained her calm, composed manner even in crisis. Doctors were taught to stay professional. Even when they were the patient, what kind of doctor were you? Cardiac surgeon. Patricia's hands froze for a moment. A cardiac surgeon? This woman knew hearts. She knew what a heart attack felt like because she had treated hundreds, maybe thousands of them. When she said her symptoms were serious, she knew what she was talking about. And Dr. Thornton had dismissed her anyway. Where did you practice? Patricia asked, trying to keep her voice steady. Massachusetts General Hospital. For 35 years, Massachusetts General. That was one of the best hospitals in the country. This wasn't just any retired doctor. This was someone who had been at the top of her field. As Patricia adjusted Mrs. Williams's hospital gown to check her breathing better, something caught her eye. There was a badge clipped to the inside of the gown, hidden from view. It must have been there the whole time, but no one had noticed it. Patricia's fingers trembled slightly as she moved the fabric aside to see it better. It was a hospital identification badge, but not from St. Mary's. This was from Massachusetts General Hospital. The badge had clearance codes and credentials listed on it. Patricia's eyes widened as she read the information. Dr. Eleanor Williams, Chief of Cardiothoracic Surgery. The title was followed by a list of credentials that made Patricia's head spin. MD from Harvard. Board certified in cardiac surgery. Fellow of the American College of Surgeons. Multiple awards and commendations. This wasn't just a retired cardiac surgeon. This was one of the leading cardiac surgeons in the country. This woman had probably trained doctors who now worked at St. Mary's. She had probably written papers that medical students studied. She had probably performed surgeries that were taught in medical schools, and Dr. Thornton had treated her like she was nothing. Patricia felt the blood drain from her face. Her hand went to her mouth. "Oh my God," she whispered. "What is it?" Jamie asked, coming closer. "What's wrong?" Patricia couldn't speak. She just pointed at the badge. Jamie leaned in to look, and her eyes went wide too. "Is that?" Jamie started to say. "Yes," Patricia managed to say. "That's who she is." Michael had been standing near the monitors, but he heard the commotion and came over. When he saw the badge, his face went pale. "Sweet mercy," he breathed. Mrs. Williams opened her eyes. She saw them all staring at her badge. A sad, tired smile crossed her face. "You found it," she said quietly. "Why didn't you tell us?" Patricia asked. "Why didn't you tell Dr. Thornton who you were?" Mrs. Williams took a shaky breath. "Because I wanted to be treated like any other patient. I wanted to know what healthcare looked like for ordinary people, especially for people who look like me." The words hung in the air. People who look like me. Elderly black women. People Dr. Thornton had assumed were poor, uneducated, looking for handouts. People he dismissed without proper examination. "I've heard stories," Mrs. Williams continued, her voice weak but clear. "Stories from patients about how they're treated differently in hospitals, how their pain isn't taken seriously, how doctors don't listen to them. I wanted to see if it was true." She coughed, pain crossing her face. "Now I know." Patricia felt tears forming in her eyes. This woman, this brilliant surgeon, had hidden her credentials on purpose. She had conducted a test and the healthcare system had failed spectacularly. "The conference in Boston," Patricia said, understanding now. "What was it about?" "Healthcare equity," Mrs. Williams said. "Disparities in treatment based on race and socioeconomic status." I was the keynote speaker. Of course she was. Of course she had spent her career not just saving lives, but trying to make healthcare better for everyone. And today she had gotten to experience firsthand the very discrimination she had been speaking about. Jamie's hands were shaking. "We need to tell someone. We need to tell everyone. This is huge. We need to save her life first," Michael said firmly. "That's the priority. Everything else comes after." He was right. Patricia pulled herself together. Yes, this revelation was shocking. Yes, it changed everything. But Mrs. Williams was still in medical crisis. She was still having a heart attack, and they still needed to act fast. Patricia looked at the EKG printout again, then at Mrs. Williams. "Dr. Williams," she said, using the title with respect. "Your EKG shows ST elevation. You know what that means?" Dr. Williams nodded. "I'm having a heart attack, I knew it. I tried to tell him." "We're going to get you proper treatment right now," Patricia promised. "I'm going to make sure of it." She turned to Jamie. "Stay with her. Monitor her closely. If anything changes, call out immediately." Then to Michael, "Come with me. We need to find Dr. Martinez or Dr. Patel, and someone needs to tell administration." "What about Dr. Thornton?" Michael asked. "He needs to know too," Patricia said, her voice hard. "He needs to see what his dismissiveness almost caused." As Patricia and Michael rushed toward the nurses' station, word was already starting to spread. The medical student David had been close enough to overhear part of the conversation. His eyes were wide with shock. Patricia saw him pull out his phone again, probably texting his professors or classmates about what was happening. Patricia's mind was spinning. The implications of this situation were enormous. Dr. Williams wasn't just any patient. She was prominent, respected, and influential in the medical community. Her treatment here today wouldn't just be a matter for hospital administration. This could become national news. This could spark investigations. This could end careers, but more than that, this was proof. Solid, undeniable proof that racial bias existed in healthcare. Dr. Williams had the same symptoms as any other heart attack patient, but she had been dismissed and demeaned. If this could happen to a renowned cardiac surgeon, what happened to ordinary people every day? Patricia reached the nurse's station and picked up the phone. She needed to make calls. She needed to alert people, but her hand was shaking so badly she could barely dial. Michael put his hand on her shoulder. "Breathe," he said. "We can do this. We're doing the right thing now." Patricia nodded. She took a deep breath and steadied herself. Then she dialed the number for Dr. Sarah Martinez, the ER director. The phone rang once, twice, 3 times. Finally, someone picked up. "This is the OR. Dr. Martinez is in surgery." "I need to speak with her immediately," Patricia said. "We have an emergency situation in the ER that requires the director's attention. She's in the middle of a procedure." "Unless someone is dying." "Someone might die," Patricia interrupted. "This is serious. I need her paged immediately." There was a pause. Then, "Hold on." Patricia waited, her heart pounding. She looked back toward Bay 7. Through the opening in the curtain, she could see Jamie holding Dr. Williams's hand, talking to her softly, keeping her calm. That young nurse who had questioned why they weren't fighting harder was now doing exactly that. She was fighting with compassion and care. A voice came back on the phone. "Dr. Martinez will call you back in 5 minutes. She's closing up her patient." "Thank you," Patricia said and hung up. 5 minutes. They had 5 minutes to prepare what they were going to say. 5 minutes to gather evidence. 5 minutes before this situation exploded into something much bigger than any of them had anticipated. Patricia looked at Michael. "We need to document everything. Every conversation, every symptom, every test result. We need to have the full picture ready." "Already on it," Michael said, pulling up computer records. The news spread through the emergency room like electricity through water. Fast, unstoppable, and shocking. Patricia watched it happen in real time. A nurse whispered to another nurse. A resident overheard and told another resident. The medical student David was texting rapidly on his phone. Within 10 minutes, everyone in the ER seemed to know that the patient Dr. Thornton had dismissed was actually Dr. Eleanor Williams, a legendary cardiac surgeon from one of the most prestigious hospitals in America. Patricia stood at the nurse's station, organizing the documentation. She had pulled Mrs. Williams' chart, printed the EKG results, and was writing detailed notes about everything that had happened. Her hands were steadier now. She had a purpose. She was doing something. A young resident named Dr. Angela Foster approached the station. Her face showed disbelief. "Is it true?" she asked Patricia. "Is the patient in Bay 7 really Dr. Eleanor Williams?" "The Dr. Eleanor Williams?" "Yes," Patricia said simply. "The one who pioneered the Williams technique for coronary bypass?" "I believe so, yes." Dr. Foster put her hand over her mouth. "Oh my God. I studied her work in medical school. She's in our textbooks. She's a legend. She's also a human being who's having a heart attack," Patricia said firmly, "and she needs treatment." "Of course, yes, absolutely." Dr. Foster looked toward Bay 7. "Does Dr. Thornton know?" Not yet. Dr. Foster's expression changed. She knew Dr. Thornton. Everyone in the ER knew him. They knew his reputation. "This is going to be bad," she said quietly. "It's already bad," Patricia replied. "A patient was mistreated. That's what matters." Michael came rushing up with lab results. Cardiac enzymes are back. Troponin is elevated. It's definitely a heart attack. Patricia took the results and added them to her growing pile of evidence. Every test, every number confirmed what Dr. Williams had been saying from the start. She was really sick. She needed real help, and she had been denied both dignity and proper care. Jamie appeared, slightly out of breath. "Dr. Williams is asking for you, Patricia. She wants to talk." Patricia hurried to Bay 7. Dr. Williams looked worse than before. Her lips had a blue tint despite the oxygen. Her skin was pale and sweaty, but her eyes were alert and focused. "How are you feeling?" Patricia asked, though the answer was obvious. "Like I'm having a heart attack," Dr. Williams said with a weak attempt at humor. "Which I am." She paused to catch her breath. "I need to tell you something important. Before this goes any further," Patricia leaned in close. "What is it?" "I don't want this to be about revenge," Dr. Williams said. "I don't want that doctor to be destroyed. I want this to be about change. Real change. Do you understand?" Patricia felt a wave of respect for this woman. Even now, even after being treated so poorly, she was thinking about the bigger picture. She wasn't interested in personal vengeance. She wanted systemic improvement. "I understand," Patricia said. "But Dr. Williams, what happened to you was wrong." "People need to know." "They will know," Dr. Williams replied. "But I want the focus to be on the problem, not on one person. This isn't just about Dr. Thornton. This is about a system that allows patients to be dismissed based on how they look. I'm betting I'm not the first person he's treated this way. And if nothing changes, I won't be the last." She was right, of course. Michael had said as much earlier. Dr. Thornton had a pattern of behavior. He had been getting away with it for years because his victims were usually people without power or influence, people who couldn't fight back. "You're a surgeon," Patricia said. "You saved lives. You trained other doctors. You should have been treated with respect." "Everyone should be treated with respect," Dr. Williams corrected her gently. "That's the point. It shouldn't matter that I'm a surgeon. My pain should have been taken seriously because I'm a human being. The elderly black woman in the next bay over who works as a housekeeper deserves the same care I do." Patricia nodded, understanding. Dr. Williams was right. The horror of this situation wasn't just that a famous doctor had been mistreated. The horror was that ordinary people faced this treatment every day, and no one paid attention because they didn't have impressive credentials. The phone at the nurse's station began ringing. Michael answered it, then called out, "Patricia, it's Dr. Martinez." Patricia squeezed Dr. Williams' hand. "I'll be right back. Jamie will stay with you." She rushed to the phone and picked it up. "This is Patricia Chen. Patricia, this is Dr. Martinez. I was told there's an emergency." "What's going on?" The ER director's voice was tense. She had just come from surgery and didn't like being interrupted. Patricia took a deep breath. "Dr. Martinez, we have a patient in Bay 7. She came in with chest pain about an hour ago. Dr. Thornton examined her and dismissed her symptoms as anxiety or stress. He ordered minimal testing, but her EKG shows ST elevation, and her cardiac enzymes are elevated. She's having an acute myocardial infarction." There was a pause. "And you're calling me why?" "This should be handled by the attending physician." "There's more," Patricia said. "The patient is Dr. Eleanor Williams. She's the recently retired chief of cardiothoracic surgery at Massachusetts General Hospital." The silence on the other end of the phone was deafening. It stretched for several seconds. When Dr. Martinez spoke again, her voice was different, controlled but with an edge of panic underneath. "Please tell me you're joking." "I'm not joking. Dr. Eleanor Williams." "The Dr. Eleanor Williams?" "Yes." "And Dr. Thornton dismissed her cardiac symptoms as anxiety?" "Yes. He told her she was overreacting and wasting hospital resources. He suggested she was looking for a free place to stay." Patricia heard what might have been cursing on the other end of the line, muffled as if Dr. Martinez had covered the phone. "Then I'm coming down right now. Get a cardiology consult immediately. I don't care who. Get the cath lab ready. And Patricia?" "Yes?" "Document everything. Every word, every interaction, every test result, everything. Already doing that." "Good, I'll be there in 3 minutes." The line went dead. Patricia hung up and turned to find several people staring at her. News traveled fast in hospitals. Half the ER staff had probably heard her side of that conversation. Dr. Angela Foster stepped forward. "I'm calling cardiology now," she said. "We'll get Dr. Williams the care she needs." Other staff members mobilized. A nurse ran to prepare the cardiac catheterization lab. A resident began preparing transfer paperwork. Everyone moved with purpose and urgency, the way they should have been moving from the moment Dr. Williams arrived. Patricia noticed Dr. Thornton across the ER. He was writing notes on a tablet, still oblivious. Someone needed to tell him. Or maybe it was better to let Dr. Martinez handle it. Patricia wasn't sure. The decision was taken out of her hands. One of the residents, unable to contain the news, walked up to Dr. Thornton and said something. Patricia watched as Dr. Thornton's face changed. First confusion, then disbelief, then something that looked like fear. He looked toward Bay 7, then at Patricia. Their eyes met across the busy ER. Patricia didn't look away. She held his gaze, letting him see the disappointment and anger she felt. Dr. Thornton put down his tablet and started walking toward Bay 7. Patricia moved quickly to intercept him. "I need to see my patient," he said. "Dr. Martinez is on her way down," Patricia replied. "She's taking over the case." That's not necessary. I can handle this, can you? Patricia asked, her voice harder than she intended. Because you didn't handle it an hour ago when Dr. Williams first arrived. Dr. Thornton's face flushed red. I didn't know who she was. That shouldn't matter, Patricia said. Every patient deserves proper care and respect, regardless of who they are. I provided appropriate care based on the initial presentation. You told her she was wasting resources. You suggested she was looking for a free bed. You dismissed her pain as anxiety without proper examination. Dr. Thornton started, but the words died. He knew she was right. They both knew it. The elevator doors opened and Dr. Martinez emerged, still in her surgical scrubs. She was a small woman with short black hair and sharp, intelligent eyes. Right now, those eyes looked like they could cut through steel. Dr. Thornton, she said, her voice carrying across the ER. My office, now. I need to see my patient first. Your patient is being transferred to cardiology, Dr. Martinez interrupted. Dr. Foster is handling it. You and I need to talk. Immediately. It wasn't a request. Dr. Thornton followed Dr. Martinez toward her office like a child being sent to the principal. Patricia felt no satisfaction in watching it. This wasn't about punishing Dr. Thornton. This was about protecting patients. A cardiologist arrived within minutes. Dr. James Chen was known for being excellent and fast. He went straight to Bay 7 and introduced himself to Dr. Williams. Dr. Williams, I'm Dr. Chen from cardiology. I'm going to take over your care. I apologize for the delay in getting proper treatment started. Dr. Williams nodded weakly. Thank you, Dr. Chen. I think I need to go to the cath lab. Agreed. We're preparing it now. You'll be there in 10 minutes. As the cardiology team took over, Patricia stepped back. Her job was done. She had advocated for her patient. She had documented everything. She had alerted the right people. Now the specialists would take over. Jamie came to stand beside her. We should have fought harder from the start, the young nurse said quietly. Yes, Patricia agreed. We should have. But we're fighting now, and we'll keep fighting. For every patient who comes through these doors, Michael joined them. The word is spreading beyond just our ER. Someone posted something on social media. This is going to get big. Patricia felt a knot form in her stomach. Dr. Williams had said she didn't want this to be about revenge or publicity, but the story was too big to contain. A renowned surgeon experiencing discrimination while seeking emergency care. The media would love it. She looked back at Bay 7 where Dr. Williams was being prepared for transport. The elderly woman had wanted to be treated like any other patient, and instead she had exposed a painful truth about healthcare in America. Sometimes the only way people paid attention to injustice was when it happened to someone important. But that was wrong too. Everyone's pain should matter. Everyone's dignity should be protected. That was what Dr. Williams had been trying to prove, and she had succeeded in the worst possible way. Dr. Martinez's office was small but organized. Medical journals lined one shelf. Certificates and awards hung on the wall. A desk held a computer, neat stacks of papers, and a photo of Dr. Martinez with her wife and 2 children. Dr. Thornton sat in one of the chairs facing the desk. He had never felt so uncomfortable in his entire career. Dr. Martinez sat down and opened a folder. She didn't speak right away. The silence grew heavy and thick. Dr. Thornton shifted in his seat. Do you know who Dr. Eleanor Williams is? Dr. Martinez finally asked. I do now, Dr. Thornton said. That's not what I asked. I asked if you know who she is. Dr. Thornton swallowed. She's a cardiac surgeon. From Massachusetts General. She was the chief of cardiothoracic surgery at one of the best hospitals in the world for 20 years. She trained dozens of surgeons who now work at major medical centers. She pioneered techniques that are standard practice today. She's published over 100 papers. She's won every major award in cardiac surgery. And this morning, she came to our emergency room with classic symptoms of a heart attack. And you told her she was wasting our resources. I didn't know who she was, Dr. Thornton said again. Dr. Martinez's eyes flashed with anger. That's not the point. That's never been the point. You should have treated her properly regardless of who she was. But the fact that you didn't know makes it worse, not better. It means you looked at an elderly black woman and made assumptions about her. You decided she wasn't worth your time or your expertise. I assessed her symptoms. You barely examined her. I've read Nurse Chen's notes. You spent less than 5 minutes with the patient. You didn't do a thorough physical exam. You dismissed her pain as anxiety based on nothing, and according to multiple witnesses, you made comments suggesting she was looking for handouts. Dr. Thornton felt his face grow hot. He wanted to defend himself, but the words wouldn't come, because deep down he knew Dr. Martinez was right. He had made assumptions. He had seen an elderly black woman with Medicare insurance and decided she wasn't a real emergency. He had let his biases guide his medical judgment. "I've been a doctor for 20 years, he said weakly. "I've treated thousands of patients. And how many of them were treated the way you treated Dr. Williams today?" Dr. Martinez asked. "This isn't the first complaint I've received about you. Other nurses have mentioned concerns about how you treat certain patients. But they were always subtle things that were hard to prove. But today you had multiple witnesses. Today you were careless enough to let your bias show clearly." There was a knock on the door. Dr. Martinez called out, "Come in." A man in a suit entered. He was tall and serious-looking, carrying a briefcase. "Dr. Martinez, I'm Robert Chen from the hospital's legal department. I was told there's a situation that requires immediate attention." Dr. Martinez gestured to another chair. "Please sit down, Mr. Chen. This is Dr. Richard Thornton. Dr. Thornton, this is our chief legal counsel." Dr. Thornton felt his stomach drop. Legal counsel. This was getting serious fast. Mr. Chen sat down and opened his briefcase. He pulled out a notepad and pen. "Dr. Martinez filled me in on the basic facts. Dr. Thornton, I need to hear your version of events. Start from when you first saw the patient." Dr. Thornton took a deep breath and began to explain. He described how busy the ER was. He talked about the patient's initial presentation. He explained his thinking process. As he spoke, his explanation sounded weaker and weaker, even to his own ears. "So you determined it was anxiety based on what exactly?" Mr. Chen asked. "Her vital signs were elevated, but not critically." She mentioned stress. "Her description of symptoms could have been consistent with anxiety or GERD." "Could have been, but they were also consistent with acute coronary syndrome, correct?" "Yes, but statistics don't diagnose individual patients," Mr. Chen interrupted. "What specific findings led you to rule out cardiac causes?" Dr. Thornton had no good answer. He had made a judgment call based on a quick examination and his own biases. He had been wrong, and now everyone knew it. "I made an error in judgment," he finally admitted. "That's one way to put it," Dr. Martinez said. "Another way is to say you provided substandard care based on the patient's race." "I'm not racist," Dr. Thornton protested. "I'm not interested in what you think you are," Dr. Martinez said. "I'm interested in how you behaved. And your behavior today was discriminatory, dismissive, and dangerous. If Dr. Williams had not been eventually identified, if her credentials hadn't been discovered, she might have been sent home and died. Do you understand that?" The weight of those words hit Dr. Thornton hard. A woman could have died because of his assumptions. A brilliant surgeon, a mother, a grandmother, a human being could have died because he didn't take her seriously. "What happens now?" he asked quietly. Mr. Chen looked at Dr. Martinez, who nodded. "You're being suspended immediately," Mr. Chen said. "With pay pending a full investigation. We'll be interviewing every staff member who witnessed the interaction. We'll be reviewing your patient files for patterns of bias, and we'll be conducting a formal disciplinary hearing." "I've worked here for 15 years, Dr. Thornton said. "This is my career." Dr. Williams worked as a cardiac surgeon for 35 years, Dr. Martinez replied. That was her career. And today she was treated like her life didn't matter. "Actions have consequences, Dr. Thornton." There was another knock on the door. This time it was Patricia. "Dr. Martinez, I'm sorry to interrupt. Dr. Williams is being taken to the cath lab now. The cardiology team says she has a severe blockage in her left anterior descending artery. They're performing an emergency angioplasty." Dr. Martinez closed her eyes briefly. "Thank you, Patricia. Please keep me updated." After Patricia left, Dr. Martinez turned back to Dr. Thornton. "Do you see? She has a major blockage. This was a real emergency. Your dismissal could have killed her." Dr. Thornton put his head in his hands. His career was probably over. His reputation was destroyed. But worse than that, he had to face the truth about himself. He had let his biases harm a patient. He had become the kind of doctor he never thought he would be. "I want to apologize to her," he said. "That's not your decision to make," Mr. Chen said. "Any contact with the patient needs to be approved by legal counsel and by Dr. Williams herself. Right now, Your job is to cooperate with the investigation. What about my other patients? They'll be reassigned, Dr. Martinez said. You're not to have any patient contact until this is resolved. You need to go home and wait for further instructions. Dr. Thornton stood up slowly. His legs felt weak. As he walked to the door, Dr. Martinez spoke again. Dr. Thornton, one more thing. I hope you use this time to really think about your behavior, not just today, but throughout your career. Think about the patients you might have dismissed or mistreated without realizing it. Think about the harm you might have caused. Real change requires real self-reflection. Dr. Thornton nodded but said nothing. He left the office and walked through the ER. Everyone seemed to be staring at him. Nurses whispered as he passed. A resident quickly looked away. The medical student David watched him with an expression of disappointment. He got his things from his locker and left the hospital. Outside, the day was sunny and beautiful. People walked by on the sidewalk, going about their normal lives. None of them knew that inside this building, a man's career had just ended and a woman had almost died because of bias and prejudice. Dr. Thornton sat in his car for a long time before he could start the engine. He thought about Dr. Williams. He thought about the other patients over the years. How many times had he made quick judgments based on appearances? How many people had received less than his best care because of assumptions he didn't even know he was making? The truth was painful. He had become part of the problem. He had contributed to the very healthcare disparities that everyone talked about, but few wanted to admit they participated in. Back in the hospital, the cath lab team worked quickly and efficiently. They found the blockage in Dr. Williams's heart and placed a stent to open the artery. Blood flow was restored. Her heart rhythm stabilized. She was going to survive. Dr. James Chen, the cardiologist, came out to the waiting area where Patricia and Jamie had been sitting. They had wanted to stay and know the outcome. She's going to be okay, Dr. Chen said. We got the artery open in time. There's some heart muscle damage, but it could have been much worse. If she had been sent home as Dr. Thornton planned, she probably would have died within hours. Patricia felt tears of relief slide down her cheeks. Can we see her? In a little while. She's in recovery now, but she asked about you. She specifically asked if the nurse named Patricia was still here. I'll wait, Patricia said. Dr. Chen smiled. She also said to tell you that you did the right thing. You advocated for your patient. That's what nursing is about. After Dr. Chen left, Jamie turned to Patricia. You saved her life. Patricia shook her head. We all did. You, me, Michael, Dr. Martinez, the cardiology team. We all played a part. That's how it should work. Everyone working together for the patient. Do you think things will really change? Jamie asked. Or will everyone forget about this in a few weeks? Patricia thought about that. Change was hard. Institutions resisted it. People got comfortable with the way things were. But sometimes an event was big enough and public enough that ignoring it became impossible. I think Dr. Williams won't let them forget, Patricia said. And neither will we. We're going to make sure something good comes from this terrible situation. Jamie nodded. I'm going to be a better nurse because of what happened today. I'm going to speak up sooner. I'm going to fight harder. Good, Patricia said. That's exactly what we need to do. They sat together in the waiting room, two nurses who had witnessed something they would never forget, waiting to check on a patient who had changed everything. 3 days had passed since Dr. Eleanor Williams arrived at St. Mary's Hospital emergency room. She now sat in a private recovery room on the cardiac floor. The window beside her bed showed a view of the city. Sunshine poured through the glass, making everything feel hopeful and new. Her daughter Michelle sat in a chair beside the bed. She had flown in from California as soon as she heard about her mother's heart attack. Her face still showed worry, but the worst was over. Her mother was alive and recovering well. You scared me half to death, Michelle said, holding her mother's hand. When the hospital called and said you had a heart attack, I thought I might lose you. Dr. Williams squeezed her daughter's hand. I'm sorry, baby. I didn't mean to worry you, but I'm okay now. The doctors here did excellent work once they actually started treating me. Michelle shook her head. I still can't believe what that doctor said to you. How he treated you. It makes me so angry. Use that anger for something good, Dr. Williams said. That's what I plan to do. There was a soft knock on the door. Patricia Chen entered carrying a small vase with flowers. She had stopped by every day to check on Dr. Williams, even though she wasn't assigned to the cardiac floor. I hope I'm not interrupting, Patricia said. Not at all, Dr. Williams said with a warm smile. Come in, please. Patricia, this is my daughter Michelle. Michelle, this is Patricia Chen, the nurse who saved my life. Patricia blushed. I just did my job. You did more than that, Dr. Williams said firmly. You advocated for me when it would have been easier to stay silent. That takes courage. Michelle stood and hugged Patricia. Thank you for taking care of my mother. I don't know what I would have done if... Her voice broke and she couldn't finish the sentence. Your mother is strong, Patricia said, and she's going to be fine. Dr. Williams gestured to another chair. Sit down. I wanted to talk to you about something. The hospital administrator, Mr. Davis, came to see me yesterday. He apologized on behalf of the hospital. He assured me there would be consequences and changes. Good, Patricia said. There should be. He asked me what I wanted, how the hospital could make this right. Dr. Williams paused. I told him I don't want money. I don't want a lawsuit. I want real change. Lasting change. Patricia leaned forward. What kind of change? I want St. Mary's to become a leader in addressing healthcare bias, Dr. Williams said. I want mandatory training for all staff on implicit bias and cultural competency. I want protocols in place to ensure every patient gets thorough evaluation, regardless of their appearance or background. I want a system where nurses feel empowered to speak up when they see problems. That's ambitious, Patricia said. But necessary, Mr. Davis agreed. In fact, he's asked me to help develop the program. He wants me to consult with St. Mary's on creating a comprehensive equity initiative. Michelle looked at her mother with pride. You're going to fix the system that failed you. I'm going to try, Dr. Williams said. But I can't do it alone. Patricia, I'd like you to be part of this. You and the other nurses who were there that day. The medical student, too. We need voices from all levels of the hospital. Patricia felt honored and overwhelmed at the same time. I'd be grateful to help. But Dr. Williams, you should be resting, not planning projects. Dr. Williams smiled. My body needs rest, but my mind is sharp. And this is important. If I can turn what happened to me into something that helps others, then the pain and humiliation will have meant something. Over the next few weeks, news of the incident spread beyond St. Mary's Hospital. A medical journal published an article about it. Dr. Williams gave an interview to a major news network. Social media buzzed with discussions about racial bias in healthcare. The story touched a nerve because so many people had similar experiences or knew someone who did. At St. Mary's, changes began immediately. Dr. Thornton's employment was officially terminated after the investigation found a pattern of discriminatory behavior toward minority patients. Several other complaints came forward once people learned they could speak up safely. He lost his medical license 6 months later after the state medical board conducted its own investigation. Dr. Sarah Martinez, the ER director, led the charge for institutional change. She created a bias response team that could be called whenever a staff member witnessed discriminatory treatment. She instituted a policy where nurses could flag cases for second opinions without fear of retaliation. Jamie Rodriguez became one of the strongest voices for patient advocacy. The young nurse who had questioned why they weren't fighting harder now trained other new nurses on speaking up for patients. She told Dr. Williams's story to every group of students who rotated through the ER. Michael, the experienced nurse, helped develop a peer support program. He knew that nurses often stayed silent because they felt alone. The new program ensured that staff members had support when they needed to report concerns about patient care. David, the medical student, wrote his thesis on implicit bias in emergency medicine. He cited his experience witnessing Dr. Williams's treatment as the moment he decided to dedicate his career to healthcare equity. He later became a doctor at St. Mary's and helped continue the work Dr. Williams started. 2 months after her heart attack, Dr. Williams stood in the St. Mary's Hospital auditorium. The room was packed with doctors, nurses, administrators, and medical students. She had been invited to give the keynote speech at the launch of the hospital's new healthcare equity initiative. Patricia sat in the front row beside Jamie and Michael. They wore their nursing uniforms with pride. On the stage beside Dr. Williams sat Dr. Martinez and Mr. Davis, the hospital administrator. Dr. Williams stepped up to the microphone. Her recovery had been excellent. She looked strong and confident. Thank you all for being here today, she began. 2 months ago, I came to this hospital's emergency room experiencing a heart attack. I was in severe pain. I was scared. And I was treated as if I didn't matter, not because the staff were all bad people, but because the system had failed to address bias and discrimination in patient care. The audience listened in complete silence. I want to be clear about something. What happened to me was not unique. It happens every day in hospitals across this country. Patients of color, particularly Black patients, receive less thorough examinations, have their pain taken less seriously, and face worse health outcomes because of implicit bias. I was lucky in one way. I had credentials that eventually got people's attention, but I shouldn't have needed those credentials to receive good care. No one should. She paused to let her words sink in. I hid my identity that day deliberately. I wanted to see what healthcare looked like for ordinary people who look like me. What I found was painful but important. It exposed a truth that many people didn't want to see, but now that we've seen it, we have a responsibility to fix it. Dr. Williams gestured to the people on stage with her. St. Mary's Hospital has committed to becoming a leader in healthcare equity. They've committed to training, protocols, and cultural change. But commitment is just the start. The real work is in the daily choices every person in this room makes. It's in how you listen to patients. It's in whether you question your assumptions. It's in whether you speak up when you see something wrong. She looked directly at Patricia, Jamie, and Michael. I want to recognize 3 nurses who were in the ER that day. Patricia Chen, Jamie Rodriguez, and Michael Santos. They eventually found the courage to advocate for me. They eventually did the right thing. But they've told me they wish they had done it sooner. They've told me they'll never stay silent again. That's the kind of transformation we need. The 3 nurses stood as the audience applauded. Patricia felt tears in her eyes. Dr. Williams was right. They should have spoken up immediately. They should have fought harder from the start. But they had learned from their failure, and they would do better. Starting today, Dr. Williams continued, every staff member at St. Mary's will undergo mandatory training on implicit bias, cultural competency, and patient advocacy. We're implementing new protocols for patient assessment that reduce the impact of subjective judgment. We're creating a reporting system that protects staff who speak up about concerns. And we're establishing metrics to track whether patients of different backgrounds receive equal quality of care. She smiled. This is not easy work. Confronting our own biases is uncomfortable. Changing institutional culture takes time, but it's necessary. Because healthcare is a human right, and everyone deserves to be treated with dignity and respect. When Dr. Williams finished speaking, the entire auditorium rose in a standing ovation. People weren't just applauding her words. They were committing themselves to the work ahead. After the ceremony, Patricia approached Dr. Williams. That was a powerful speech. Thank you. But words are easy. The real challenge is making sure the changes last after the initial attention fades. They'll last, Patricia promised. We'll make sure of it. Dr. Williams took both of Patricia's hands in hers. I believe you will. You know, in a strange way, I'm grateful for what happened. Not the heart attack itself, but the opportunity to turn a terrible experience into something meaningful. If my pain can prevent someone else's, then it was worth it. You're remarkable, Patricia said. I'm just a person who wants healthcare to be better for everyone. That's not remarkable. That should be the baseline. 6 months later, St. Mary's Hospital was recognized nationally for its equity initiative. Other hospitals began reaching out to learn from their program. Dr. Williams traveled around the country, speaking at medical conferences and training programs. Her message was always the same. Healthcare disparities were not inevitable, they were a choice, and we could choose differently. Patricia was promoted to Director of Patient Advocacy. Her job was to ensure that the lessons learned from Dr. Williams' case were embedded in every aspect of hospital care. She loved the work because it meant she could make a real difference. Jamie became the youngest nurse to serve on the hospital's ethics committee. She brought the perspective of someone who had learned the hard way about the importance of speaking up. Michael retired a year later, but he stayed involved as a volunteer, mentoring young nurses and sharing his experience. The medical student, David, completed his residency and returned to St. Mary's as an attending physician in the emergency room. He often thought about that day when he witnessed something wrong and didn't know how to respond. Now he made sure every student he taught understood the importance of patient advocacy and cultural humility. And Dr. Eleanor Williams, the cardiac surgeon who had retired to enjoy her remaining years in peace, found a new purpose. She became a voice for patients everywhere who had been dismissed, ignored, or mistreated. She proved that even terrible experiences could become catalysts for change if people had the courage to speak the truth and the determination to make things better. 1 year after her heart attack, Dr. Williams returned to St. Mary's Hospital. But this time she arrived not as a patient, but as a guest of honor. The hospital was dedicating a new wing for cardiac care, and they had named it the Williams Center for Equitable Health Care. At the dedication ceremony, Dr. Williams stood with Patricia, Jamie, Michael, and many others who had been part of the transformation. She looked at the building that bore her name and felt a sense of peace. "This isn't just about me," she told the crowd. "This is about every patient who has ever felt invisible. Every person who has been dismissed because of their race, their class, their language, or their appearance. This center stands as a promise that we can do better, that we will do better." As the audience applauded, Patricia thought about how much had changed in 1 year. One terrible experience had sparked a movement. One woman's courage had inspired hundreds of people to examine their own biases and behaviors. One moment of crisis had become a turning point. Change was possible. Not easy, but possible, and it started with people who cared enough to fight for what was right. Even when it was hard, even when it was uncomfortable, even when it cost something. Dr. Williams had shown them all that dignity was not something you had to earn with credentials or status. It was something every human being deserved simply by virtue of being human, and healthcare that truly served all people required more than medical knowledge. It required compassion, humility, and the courage to see our own failings and choose to grow beyond them. As the ceremony ended and people mingled, Dr. Williams found Patricia one last time. "How do you feel?" she asked. Patricia smiled. "Hopeful. I feel hopeful." "Good," Dr. Williams said. "Hold on to that feeling, because this work is never finished. Every day we have to choose to be better. Every patient deserves our best. Not because of who they are or what they've accomplished, but because they're human beings in need of care." "I'll remember that," Patricia promised. "I know you will," Dr. Williams said. "You already proved it when you finally decided to fight for me. Now you just have to keep fighting for everyone who comes through those doors." Patricia nodded. She would keep fighting. They all would, because they had learned the most important lesson medicine had to teach, that science and skill meant nothing without compassion and justice. That healing happened not just in operating rooms and with medications, but in moments of human connection, dignity, and respect. The badge that had changed everything now hung in a frame in the hospital lobby. Beside it was a plaque that read, "In honor of Dr. Eleanor Williams, who taught us that every patient deserves to be seen, heard, and valued. May we never forget this lesson." And because of what had happened, because of the courage it took to face an uncomfortable truth, and the determination to make real change, they never did forget. St. Mary's Hospital became a different place, better, more just, more worthy of the trust patients placed in it. All because one woman refused to let injustice be swept under the rug, and because good people finally found the courage to stand with her.